intending, subject to board endorsement, to launch this over the summer. We want to be completely transparent with our workforce about what we're committing to, and equally completely transparent about the progress that we're making. We're in conversation with Simon and his team about how to launch this. Our view is that our management and leadership community are going to be absolutely critical here. They're obviously a key part of the people plan itself, and there's a lot we want to do to set that community up for success. But we know they also really need to understand the ambitions here and be able to translate that in conversations with their teams about what it's going to mean for their teams specifically. So we want to do some specific launch events with our management and leadership community over the summer to really get underneath this with them. The final point that I wanted to make is that we really want this to be a living document. We don't want it to be a kind of strategy document that ends up being a piece of shelfware. So fully up for changing this. If things don't work, we will iterate and improve. We also want to embed this in an annual cycle on the back of our staff survey each year. So on the back of our staff survey results, we will have another round of conversations with our people about what does this mean for our people plan, what has worked, what hasn't worked, and what do we need to be doing differently going forwards. I think that's covered everything I wanted to say, so I'll pause for a breath, see if there's any questions.
Thanks, Hayley. Can I say how much I also appreciate the fact that we included a section around success measures, and also trying to encapsulate it as a, the people plan on one page. The visual nature of that I think is quite important for staff members who might not want to read the whole document, but just to try and capture the essence of what we're saying, I think is really important. And I think let's get plugged up. There's some huge posters and stick it all over the organisation. I think might be quite useful. Right, Paul, I think we're committed to this one.
Well, yeah, and I would have to agree. I guess I would trust ourselves to say that's great, but if we're going to do that, we're going to deliver it. Because by putting all this out there and putting promises up, we will be very quickly undermined if people say, well, nothing's changed in my area. So I think what and Hayley's touched on, we've had a lot of conversations about this from the execs about it, is another bit is the line management. Because largely 95% of people's experience of their job is governed by how that team or department is managed. And where we've had fantastic managers, you see fantastic results in terms of staff survey and people's contentment at work. And we equally know as soon as you've got an area where you're having problems, we've had some recent examples of that where we can pinpoint it straight down to the line manager who is perhaps not as effective as you would like. And that's what's driving the culture, the behaviours, the experience for our staff. So I'm really welcoming focus on line management in this process, because they are so fundamentally important, and it's not just in clinical areas, it's in the facilities team, the estates team, the health sciences, the labs, everywhere. It's really important. So I think there's something for me about Hayley touched on the content engagement about this. There's something about how we bring some of those people together and set our expectations to them as well, because this isn't going to be delivered by us or the execs doing this. This is going to be delivered by everybody delivering this. So it's really important this is seen as a collaborative effort on behalf of everybody, not a passive set of people at band 7 level who are going to just be told this is how, that's what we've been told to do because there's a people plan. This has got to be their people plan that they own and that they say, and going back to our earlier conversation about their rosters, I guarantee you the success of that issue will be governed by how well it's handled at ward manager level. And we will have ward managers that take it and run with it and really work through with their teams how they're going to make it work in reality. And there'll be other department wards where we'll have problems because the ward manager hasn't managed to sort of articulate an effective way to their team. So I think it's a really, really important thing, and also the content engagement and messaging around this, making it really relevant for people, because there is so much frustration. My second point is going to be a lot of points Hayley's made in this is rightly about things like recruitment, and I think we've also got to be really clear about what's in our control, but also we shouldn't be afraid to go to the partner organisations who are part of that process, e.g. shared services, because they govern a lot of the recruitment process, and candidly that isn't always their aspirations about what we want to do. It aren't aligned. So I was having a conversation yesterday about shared services as part of this review, saying part of the problem we have is they don't have skin in the game because they're not the people there dealing with the issues when the staff aren't starting on time or there's been a delay to the recruitment. They're sat in an abstract location managing a process, which is fair enough because that's how we've designed it. But I think we've got to be more explicit about what we want them to do and change to help us deliver this ambition, because I think some of these things will and Hal knows as well, because we've tried to make changes previously. It's been quite a protracted process, hasn't it, to try and shift the mindset into more of a reactive responsive service. So I think we might want to think how we translate some of those elements, Hayley, into sort of conversations with shared services about what's their part they're going to play in helping us deliver it as well.
Yeah, thank you. I think sort of what Hayley was saying, wanting staff to really own this and it being sort of quite dynamic. Absolutely, we need to go kind of like line management to really sort of promote this. But if we want staff to own it, like really get involved with them and try and get us as like trade unions to kind of support in that as well, and work with the line managers in our roles to sort of join forces and support that as well.
Would really welcome.
Just that was a question or a point for Hal and for Hayley. Just in terms of the board role, you bring in this today for approval, which means the board has an involvement and in fact a level of ownership over the plan. So from our point of view, I think the assurance bit is really important going forward. So thinking about your reports to the board, Hal, particularly when we look at delivering our plan, obviously I know you focus on those things that we have to report to others in terms of our workforce, but there's some really key success measures in here. It might be worth thinking about the frequency of that reporting, how we incorporate those success measures back to board, so the board has the assurance that there are things being done to deliver on this particular on this plan. I think I know that's only one bit of it, and I absolutely agree with Hayley and with Paul. This is going to be owned and delivered by a lot of other people out in the organisation who will have a much greater impact than we can, but we have that role of the assurance bit. So I think it might be good to think about how we incorporate that as part of your plan.
I think that'd be brilliant. I think that's one of the things we've intended to do in any event. It's a bit of a shift away from what we look at in workforce targets at the moment are largely lag indicators after the event. They're too late. So what this gives us an opportunity to do is to reset that so that we're looking at some of the preventative, more contributory factors. So we'll do that work as part of what we do next to understand how we align that into our performance reporting into board and other places.
Thanks. Carolyn.
Yeah, you sort of covered one of the points I was going to make, which is what comes back to here. So I think it's two things really. It's about how well is it being delivered, but it would also be useful, I think, for the board to know how it has been received.
Yes.
So I think when that comms thing has happened, I'd just be really interested, because we've all got variable experience of people being quite cynical about these things, going, yeah, the proof will be in the actual delivery. But I think the plan itself, I had an opportunity to go through it in some detail with Hayley. It's really, really good. I mean, it's straightforward, it's simple, it's not jargony, it's really well presented, but the critical thing will be in the delivery. And I think, as you said, that's what role the board has in that. But so I think it is about the success measures, but obviously the staff feedback, and also really encouraging to hear that it's going to evolve with the response to each staff survey. Some of these things are going to take a longer time, aren't they, before you see any impact. So it's important not to keep chopping and changing if we don't, stating the obvious. But I'm fully supportive of it. But I think it will be really interesting to see how it's received and to look at the success measures back. Thank you.
I think in terms of the comms engagement, we shouldn't just, this isn't also about just engaging the staff we currently employ. I guess my question is also, how do we share this messaging so with every new joiner? Because there's something about the letter, when I look at what we send people when they join, we need to be sort of sharing some of his aspirations so that people coming into the organisation or even doing our recruitment can think, oh, actually, this is an organisation that is trying to address some of those things we all know are common in all NHS organisations. And as Caroline said, that we're not under no illusion we're going to turn the tide on this in 6 months. But some of the things we can. And I think it's really important that we get in early with people and sort of share this sort of messaging with people as part of our comms to people who are joining.
Yeah, completely agree with that. But I think the point you made and Carolyn made about it's got to be real.
Yeah.
So this is not a people directorate plan.
No.
This is a people plan for our organisation. my team obviously will have a huge focus on this, but we as leaders have got to make this happen, frankly, because the worst thing we can do is articulate that ambition and not deliver on it. And we've got to show people it's different because they will have seen things like this before. So we've got to follow through on these things. Yes.
Hey,
But this is really attractive to prospective employees, isn't it? So we definitely need to shout about it even before they're there. So even like, little link to it on your recruitment. This is the job spec. This is the person spec. This is our people plan. Smash it out there.
Yeah, and I think that story at the beginning about what it feels like to work here when we're at our best, that I genuinely recognise that.
Yeah.
And we should be using some of that language. We do the whole there's 14,000 people working, we cover this area, all that. That's a really good narrative created by our own people to encourage people to come and work here. So there's real opportunity in that as well, I think.
yeah. Any other questions or points? Okay, so the paper's before us for approval. Howell?
So sorry, I can't let the opportunity pass just to thank Hayley for incredible work to pull this together in such a short time and to reflect so accurately the organisation. I think that we all recognise. So thank you very much for that.
Thank you, Hayley. Thank you. Thanks, thank you much indeed. So it's before us for approval. Can I recommend to the board that we approve the people plan for us? Thank you very much indeed. Terrific. That's great. Thank you, Hal, and thank you, Hayley. Okay, just moving on to item 7. So we have the annual review of the Wellbeing of Future Generations Act statement and objectives. Philip, thank you very much.
Chair. I take the paper as read, and I will assume people's awareness of the flagship nature of the Wellbeing of Future Generations Act. I will not be testing you on the 4 domains of wellbeing, the 7 ways of 7 wellbeing goals, and the 5 ways of working. You'll be pleased to hear. But we have, as an organisation, got a duty not only to publish objectives on a regular basis, or publish objectives, but also take reasonable steps to achieve them as well. And so, again, I need to thank Kate May, my assistant director, for undertaking a lot of this work. But looking across the organisation, there is a lot of good work that is being undertaken with a view to how this organisation approaches sustainability and how we embed sustainability in everything we do. Our current objectives are to work with communities and partners to reduce inequality, to promote well-being and prevent ill health, provide high-quality, evidence-based, accessible care, to ensure sustainability across economic, environmental and social domains, and co-create with staff and partners a learning, growing culture. And clearly the people plan you just heard is emblematic of that. So, having reviewed everything, it was identified that we were missing a key area that is proposed that we include, which is to embed the Welsh language in all that we do, recognising the importance of Welsh in people's care and our contribution as an anchor institution to the wider aim in Wales of reaching 1 million Welsh speakers. So I'm just asking the board to note the update included in the paper and to approve the additional wellbeing objective linked to our ongoing commitments to embed the Welsh language in our.
Thank you, Philip. Okay, so there's two points of approval required after us. Just in terms of the update report, any questions to Philip on that, or any points?
Just as a point of information, it is 10th anniversary. The Equality and Social Justice Committee is undertaking post-legislative scrutiny of the Act to see how much it is within the lived processes of organisations. So we'll be reaching out to people again in terms of reviews.
And just in terms of reviewing, obviously, having served for 6 years on the Audit and Risk Committee of the Future Generation, or the previous Future Generations Commissioner, we were living and breathing this stuff. And one of the questions that was frequently asked was the impact bit. And do public bodies merely take note of this, include a few lines in reports to say yes, we're taking account of the Future Generations Act. and it is quite hard in some respects to really assess the impact of something, even though it's been around for 10 years. And I think, so the question in my mind was the extent to which do we make any changes in what we do as an organisation to attempt to demonstrate how we're using it. And I'm conscious that it's feeding into the narrative about how we explain decisions, how we explain changes in what we do. But it's whether or not there's anything else that we could be doing a bit more effectively to try and explain the impact. It is quite, in some respects, maybe that is quite negative. That's the problem with it.
Yeah, and I think the discussions that are taking place at the moment about how we measure the spend on prevention, for example, even how we define what we mean by prevention and the different tiers of prevention, I think it's going to be critical to that process. But I mean, there's a hell of a lot of good work going on in terms of what is explicit sustainability.
Yeah.
What is the work that's going on around the Welsh language or the culture of the organisation and the work within their step on, for example.
Yeah.
But I also think, John, that it's people are doing a lot of this work. If you said to them, "Are you doing that work under the auspices of the future generations?" Out there, they wouldn't know. But you think about all the work that we're doing on children and young people services and improving those areas for future, the work we're doing on sustainability and carbon reduction. If you would say to the people involved in it, it all contributes to our overall approach to Future Gen Act. But I think people in their headspace are doing it because they're focusing on the carbon reduction agenda or the children and young people's agenda. So I think there's something you're right to, but it's probably just stability quite helpful being able to sort of pull those strands together and be able to sort of pull the whole. And but I think there is a presentational thing to this.
Yeah, absolutely. Okay, thank you. So, so 2 points of approval. So, to approve the report in front of us, and also the addition of the Welsh language measure as well. All happy to give their approval. Thank you very much indeed. Thank you. Thank you, Philip. Moving on to item 7.2. It's a paper from me, and this is in respect of the work being done to establish a South East Wales Regional Joint Committee following the direction from the Cabinet Secretary recently. So just to bring up to speed as to what is being done to get us to the point at which this committee will be established, we've asked the 3 board secretaries for CTM and R11 and Cardiff Vale Health Boards to work together in the first instance to consider what the terms of reference could and should look like ideally for this new committee, taking into account what the Cabinet Secretary has set out in his letter of direction, but also taking into account the other joint working arrangements that now exist elsewhere, in particular Swansea Bay and Howell Dda, where they already have a joint committee in operation. Obviously, as I mentioned in my chair's report, there is a huge amount of work that's already going on across the region of South East Wales in terms of those strong working relationships between the 3 chief executives, the 3 chairs, but also operationally between our teams delivering on a variety of different, or attempting to deliver on a variety of different services. So we've charged the board secretaries with doing a piece of work to pull together a draft terms of reference. The expectation is, subject to the chief execs and chairs being content, that draft terms of reference will come to each of the health boards by the end of September, with a view to the first meeting of the South East Wales Regional Committee taking place in October. The Cabinet Secretary said he wanted this concluded, established by the end of the calendar year, so we'll be ahead of that deadline if we are able to do that. And as I mentioned earlier, the idea is that it will capture work being done to deliver LHP, but also will take account of the programme work already being taken forward at a regional level. And at some point in the future, once we've got things established, to consider the extent of that regional working, potentially, I suppose, in other areas. But at the moment, the focus is just to bring all of this together into one place. Paul is picking up some of the work that's required over the next couple of months with chief exec colleagues. The 3 chairs and the 3 chief execs met last week. Was it this week? Yeah, it was this week. Good grief, it was this week. And we have a further meeting at the end of July just to assess progress. And look, we know that there are examples where health boards working more closely together in certain areas will deliver benefits for the population. We are very fortunate in South East Wales when you look at where our population is situated, when you look at our transportation links, the close proximity of our communities, between the communities of Annar and Bevan, Carlton Vale and CTM, there are obvious, potentially obvious opportunities there for us to be doing more together in certain service areas. And I know that work has been productive thus far. It's not easy working in partnership. I'm not going to say it's all sweetness and light. Sometimes it's difficult in a number of different ways. But I think when we're looking at this from the point of view of the patient, who quite frankly very often doesn't really give two hoots which health board they live in, I think there are opportunities there to maximise potentially what this joint working, what this means. What we will look to do is, once we have a sense of how we are developing in terms of reference, within that, by the way, it also includes Velindre and Powys as associate members, or the formal members will be the three health boards. We will do a wider engagement session for boards, executive teams and operational teams as well, just to be alert to what this is actually about and what we're expecting it to do. But the Cabinet Secretary has been very clear about the fact that there's been great progress in South East Wales, but he just wants to put a bit more momentum into the work that we are doing collectively. So this report is just for noting, just to bring you up to speed as to the work that's being done at the moment to get us to the point at which that we can establish the committee at some time in the autumn. That's helpful. But I'll keep you posted as we go through it. Patsy,
can I just ask? I mean, it's clearly what we need, and but what's going to stop it just becoming a talking shop? Where are the teeth?
Yeah. Look, I think largely this will come down to the work programme. I think it will come down to we've got to work through where this sits, and the role it will have, because we're talking about three statutory bodies who all separately have functions that they are able to discharge for themselves. So whatever this committee does, there would be questions if that committee was trying to infringe the statutory responsibilities of those partners individually. So we need to be cautious on how this will operate. I think we need to be very clear about its function, about what it is and what it isn't. So, but I think that we will be working through that with the board secretaries who are working very closely. They're also keeping Welsh Government updated as to the progress being made as well. But we've got to keep that in mind, because it's a committee that's being established because of a ministerial direction, but there are statutory functions that we have individually for which we are responsible. So this is a partnership working arrangement, and we need to be very clear to how we do it.
I don't think we've given any indication change that this committee will have delegated authority on behalf of the three health boards. But I think it's really, because I think what it will do though is it will provide a place where we can bring regional discussions that need a broader engagement and debate with the three partner organisations into a forum that is outside just the executive space. So I think historically what happens is we've got the regional oversight board, which is the three sort of exec function together, but that then goes individually back up to three, whereas actually what this will give us is a place where there's almost like an intermediate step there to actually rehearse those conversations, discuss those and debate those things before they go back up to the individual organisations, which I think will be helpful to flush out things, because what we're finding at the moment is things go into the regional, the boards, and then they come back down again because a board hasn't quite understood what that context of that conversation was, whereas this committee, for me, feels a place where those things can be discussed and agreed, so that what does then come to a board shouldn't then be pushed back down again because people aren't clear about what it's there for. Yeah.
Okay. So the things like the difficulty with the endoscopy,
exactly that.
It shouldn't happen.
Exactly.
Yeah, my question really was about the impact that it might have on the work of this board in terms of us potentially being bounced into decisions, called for urgent meetings, all of that kind of paraphernalia, so that it doesn't slow down the work of the joint committee. So I would just ask that there's some planning done around that by the joint committee so that we aren't being bounced into decisions that actually we might need to think about.
Yeah.
But I welcome the transparency of the committee arrangement because I think that will help us, as been said, around issues like the endoscopy, where at least that's been aired and it's public and the minister knows what's going on around it.
Yeah, I think it will give all of us a greater degree of understanding, I think, about where different organisations' minds are at about different topics, because at the moment that gets managed, that comes through the execs, which is fine, and we have a good three-way general exec conversation regularly. But I think once it gets into some of the more, the reality is, as we progress and regional work develops further, there's always going to be a give and take for all of us in this, and I think it's in that space that you need to be able to wear that conversation and hear where different perspectives are at. So hopefully it will help. I think, to be honest, it's going to be an iterative process over a period of time, and candidly, I don't think Welsh Government completely know what they think. Just set that up, and then they're not really sure what they think it's going to do yet. So I think which is good in a way, because it gives us the opportunity to shape it to be as effective as we want it to be.
And I think, just personally speaking, as one of the chairs, I think I want to make sure that whatever we do is focused. I don't want us creating a whole new industry around this, because history in Wales is littered with really good examples of where we set up partnership working arrangements and suddenly before long it's we've created a small multinational company. I mean, we do not want to be in a situation where the time and effort spent in this partnership space then gets in the way of the delivery that we're all expecting to work through individually as boards. But there's a good opportunity. It just creates that space to work collectively in some of these strategic areas, and hopefully with the intention of producing a benefit for our patients. And that's what our focus really has to be. But I think it's an opportunity, and it's up to us to shape it. I think that the Cabinet Secretary's letter of direction isn't overly specific, other than having it set up fairly soon, and what the membership ought to probably look like as well. Yes.
Yeah, I guess I think for a variety of things it's probably very helpful. It's just some of the assurance that it doesn't preclude bilateral discussions and conversations. Because I guess as ever with these types of arrangements, there is always a risk that we move at the appetite of the slowest, and there are some things that we will wish to. It might be that two of the health boards wish to progress at a pace, and I think we just need to be very explicit within there that it doesn't preclude bilateral and our partners can join in clearly at a later date, but I worry that we end up moving at the pace the slowest rather than actually at the need of our.
Yeah, great. Okay, thanks, Catherine. Okay, the report is just for noting, so I will keep you posted as and when things are developing. But certainly expect the terms of reference to come to the board at the end of September. Item 8.1 under strategic planning, we've got a report for noting from Vicky in respect of civil contingencies and business continuity. In Vicky's absence, I don't know if there are any questions or points on the report, but obviously if there are any concerns, then we could pick those up with Vicky on her return. So other than that, report is just for noting if the board is content. Item 9, the consent agenda. For approval, there are those items listed 9.1.1 to 9.1.4. If I could ask you just to approve en bloc those items. Thank you. And if you could just note those items listed in the 9.2. I don't believe there's any other business for today's board. And as usual, in terms of continuing to improve how our board meetings operate, if there are any comments or suggestions in terms of how the board functions and how these meetings work, please come back to us within the next 2 weeks. That would be very helpful. Just to remind colleagues, we do have an in-committee session of the board following this meeting, which will include both the capital update and the verbal update on the cluster of maternity incidents of Princess of Wales Hospital. And to confirm, the date and time of the next public board is on the 31st of July. We'll also be holding our annual general meeting on this date. We do have a board development session on Thursday, the 19th of June. In the meantime, so that will be in your diaries as well. Rydw i'n dod y cyfarfod y bob iechyd gyda'n, a hofyn y ddiolch sydd wedi ymuno ni a gwylio cyfarfod heddiw. And I'll bring the board meeting to a close and would like to extend thanks to all those who have participated in our meeting or observed our proceedings virtually. Thank you all very much. Thank you. Do you want to